If you've got numbness in these 3 fingers, stay tuned. We're going to talk about carpal tunnel syndrome. Many of us have heard of carpal tunnel syndrome, but I want to get into the details so you better understand what's going on and some of the activities that might be contributing to that pain and those symptoms. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy here in Charlotte, North Carolina. We specialize in the conservative management of musculoskeletal pain and injuries, meaning that our treatments don't entail the use of surgery, drugs, or long-term care plans. To start off, let's talk about what the carpal tunnel is. This might seem like common sense, but it is literally a tunnel. So in our wrist here, we have 8 carpal bones. Think of them as little marbles, and they're in 2 rows, kind of stacked on top of one another. Having this many small bones allows for a ton of different range of motion in that wrist. But then we also need to have nerves and muscles and tendons and all the things that control our fingers. So the carpal tunnel is a tunnel in which, so we have the 8 carpal bones, we have 9 tendons, and then we have 1 nerve that goes through that tunnel. And then we have a thick ligament that goes right over top of it. Think of that ligament as the roof over top of the tunnel. Now, the nerve that is at play here is called the median nerve. It comes out of one of the spinal nerves in the neck and then travels all the way down the arm to the fingers. Now, its final place that it goes is the fingertips. The median nerve specifically covers these 3 fingers and the half of your ring finger. So many people that suffer from carpal tunnel syndrome have numbness or tingling in these 3 fingers, specifically in that pad of the thumb. So this can either manifest as weakness in that hand, pain, or that numbness tingling sensation. Now, because of the constraints on that tunnel, all of those tendons and that nerve, they are in a confined space. So think that anything that is overworking those muscles, tendons, or any inflammation that's hanging out in that area is going to increase pressure on those nerves and on those tendons, which is going to compromise their function. Now, some things that might contribute to carpal tunnel syndrome are some of our positions that we're in throughout the day. So whether you're doing a lot of grip intensive movements, exercises, activities, all of the muscles in our forearms are the ones that their tendons go through that tunnel. So if we have a ton of muscular tension in the forearm, or specifically the flexor group, the muscles that bring the fingers in or bend our wrist inward, that is going to affect what's going through that tunnel in our wrist. Now, the other common thing that can irritate this area is computer work or typing. Specifically, that when we're typing, our wrists tend to be in an extended position and then we're flexing the fingers. So if you can envision that tendon is going through the tunnel, but then it's being asked to go a different direction for a very kind of fine movement for something like typing or moving a mouse around. And that can cause aggravation or irritation of that tendon because it's being pulled and then it's being asked to do a task on top of that. And just due to the repetitive nature of computer work or corporate working postures, this can cause a lot of aggravation, inflammation in that area, and cause a ton of that numbness or tingling, weakness that we talked about earlier. The good news is that many cases of carpal tunnel syndrome can be managed conservatively through the use of muscular work, through joint mobilization, rehabilitation, as well as some other options that we offer in the clinic. So I would invite you, if this is something that resonates with you, if this is something that feels like what you've been experiencing with your work postures or with your daily activities, I would invite you to check out our website at TruMotionTherapy.com, where we have plenty of resources and videos, as well as the ability to schedule an appointment with one of our providers. And we would love to take a look, make sure that we are getting to the root of that issue and getting you back to all the things that you love.